Thank you so much for joining us today. I know it's mid-afternoon, which is always a tough time, and we really appreciate you taking the time to learn more about classroom pooled testing. I am joined today by one of our school nurse leads, or district nurse leads, Kathleen Thompson. I will have her introduce herself in a minute. But she is here to give you the direct perspective on what it is like to run a pooled testing program in your school or district. Throughout the presentation, I will pause periodically to address questions. Please don't hesitate to ask questions along the way. This is a new concept for everyone, and so don't worry, no question is a bad question. We want you to feel confident in your understanding so that you can decide if this is a program that works in your district. I am Laura Bronner. I work on the concentric classroom pooling team. I am specifically working on programs with schools across the country, K through 12, for pooled testing. I have worked on everything from large state programs to one-off small private schools. I've worked with schools in rural areas. I've worked with schools in urban areas. We've sort of seen it all at this point. So I can give you the concentric perspective, which is a lot of breadth. And Kathleen, who I will turn it over to introduce herself, can give you the in-school, on-the-ground perspective.
I'm the school nurse leader for Medfield Public Schools. We have 7 nurses in the district, and we started Binex testing in the fall, which went very well. And we've been doing pool testing since February, and a lot of anxiety getting it up and running, but got lots of supports and had some extra nursing staff on, and it has gone really, really well. And happy to share what we've done here. The logistics was always a little tricky at the high school level, getting it going. So if anyone would like to hear about that, happy to let you know how we made that work. But it's been great. We have, had not had a lot of positive pools. I think we're up to 6, but it was great. Last week we got 1 and ended up finding 6 other kids who had been at a party together and got all their 90 close contacts out of school. So that was really great, that it worked so seamlessly. And so we're a big proponent. I think our staff and our families, I think, feel a lot safer and better about having kids back in school full time. And that was one of the things that we said to families. The reason we really encouraged pool testing, I think that's why our numbers really got elevated pretty quickly from 70 to 80%. Started elementary schools a few weeks back, and we're up in the early 70% of parents, because our families really want kids back in school. And I think between vaccinations and pool testing, I think everybody's feeling a little safer.
Yes, I couldn't agree with you more, Kathleen. And I will speak on behalf of the concentric team. We are all here because we believe firmly that this is a great way to get students back to school. As a mother of a kindergartner and a second grader, this issue is near and dear to my heart. So that is the ultimate goal. So these are the questions that we were going to cover today. As I said, feel free to ask questions at any time, but this is sort of a general list that we'll run through. Some of these I will answer from the concentric standpoint, and some of them we will ask Kathleen to answer because we know it's important for nurses to hear from other nurses and educators to hear from other educators. So just to take a step back, who Concentric is and why we were formed. Concentric is an arm of a biotech company called Ginkgo. And our goal from early on in the pandemic was to use a testing program, create a testing program really that made testing acceptable to every school in America every week. And the idea, as you all know, and can hear from Kathleen's example, is that this isn't just about testing students and testing individuals at the school. Testing at the school is a benefit to the community at large, because then once you start contact tracing, this is a huge benefit even beyond the school, that reaches beyond the school. Our classroom pooled testing program is really designed for schools. So in an ideal world, we would test every student and every staff member every week using a PCR test, just like they do in the NBA. But that is not feasible in schools, first because of cost, but second because of resources, because we know you're all stretched thin. So we came up with pooled testing as an option for schools that was a lower lift for staff and also lower cost. We are currently working with actually over 1,000 schools at this point in 18 states. That number is changing rapidly as more and more schools are signing on to our program. And as you can see, we have incredible quotes from our existing programs in Massachusetts and in Baltimore. And you heard Kathleen say it, it really is just helping families, students, and staff members feel comfortable returning to in-person learning. And I think what we're hearing now from schools who are sort of preparing for fall programs is that the hope is that this kind of program, it's very visible, it happens routinely, everybody's involved. This kind of program will help that last 10 to 30% of students return to in-person learning in the fall, which we know is a big burden for schools and communities. So just to take a step back, because you are not expected to understand what pooled testing is. We are all learning lots of new things during COVID. This is yet another one. So pooled testing is when typically we test a classroom. So picture you're starting your day in your classroom at an elementary school. Students will each receive an individually wrapped swab. They will, for the most part, self-swab. Some of the younger ones or special needs students may need some help, but they unwrap their swab, stick it up their nose. We just do the fleshy part of the nose, so it's not the brain swab that some of us had the pleasure of experiencing during COVID. Just the fleshy part of the nose. The swab goes partway up, circle 4 times in one nostril, 4 times in the other nostril. The student or staff member then takes the swab and puts it boogers down into a test tube that's sitting at the front of the class, typically in a clean coffee mug or something that sort of holds the test tube upright. The swab goes in the tube, boogers down, and that student will return to their desk. They do typically pull down their mask while they're swabbing and then put their mask right back on. Once everybody in the class has put their swab in the tube, somebody will come and, with gloves on, close up the tube. The tube goes into a biohazard bag, and the school will collect all of the tubes, scan them into our system, and FedEx them to our lab. Who does those roles happens differently by school, but typically after the first day of testing, everybody gets nervous and everybody's worried about participating. After that, typically what will happen is the teachers will, for the most part, supervise the students in doing their own self-swab, which basically means they just watch to make sure the students are doing it correctly. And then a teacher will put on a pair of gloves and close up the tube. That happens differently in different schools. Sometimes schools have a designated person who comes through, closes all the tubes. Typically, schools will have a separate person who we call the test supervisor, who will come by, typically with a cart. I think this is how it's done in Kathleen's school. Typically with a cart, they will come by, they will collect the tube. We have a barcode scanner. They will scan the tube into the system, into our system, and put it in a box and ship it to our lab. Typically, we ask schools to get their samples into a box by FedEx pickup time. We say 4 o'clock just to be safe. If you don't have FedEx near your school or in your area, we can talk about alternatives. And then we have a 24-hour turnaround time after the lab receives the shipment until you get your results. Your results come through our portal. If your test result is negative, you are all set. And if it's positive, then we'll move on to the next phase of the program. But I wanted to pause here because this is sort of the big focus for a lot of the people on this phone. It's all about, what does test day look like? Who is involved? Because I already have lots of things to do and I'm busy. And how does this work once I get my results? And so I just wanted to pause here and ask Kathleen, what does test day look like in your school? And then beyond that, how did you think about organizing your testing? So you already mentioned that your high schools test on a certain schedule and your elementary schools are a little bit different. But I'd love to hear from you, what does test day look like? And then as you were preparing for test day, how did that work?
Well, at the elementary level, it's pretty easy. We did have the consent put into a Google Doc, which helped us a lot as far as doing our rosters and figuring out where kids were when. At the elementary level, very easy. We could look at their schedules and know when they're generally in their classroom and made a schedule from there. The first time I made it, it was, I think I gave 15 minutes per class, which was crazy because it took less than 5 minutes, to do 17, 18 kids in a class. So it's gone really quickly after the first day. What I do is I go through and I number the tubes and I number the classrooms and just take that tube out for the list. I give the list to the teacher who calls the kids out into the class. I then take the list. We have kids hand sanitize. I have two people doing that just for crowd control. We have the kids separate. Again, they're professionals by now. They're 9 and 10-year-olds at my school, and they swab their nose. We always do a little demo before, but again, after the first couple weeks, they're great. Goes into the tube, boogers down, which of course they love to hear their nurse say. And it goes very, very, very quickly. We do use the courier service. I don't know if that's available everywhere. At the elementary level, just for scheduling purposes, we do on Tuesdays. The middle and high school, we do on Mondays. When we were in a hybrid model several months ago, it's hard to even remember that, we did do it both Mondays and Thursdays. We found some difficulty with that, doing it on Thursdays, because at that point, I think yesterday's results came back before midnight, like the same day, which was great. But when we first started this and we used FedEx, doing testing on Thursday gave us results on Saturday. And at one point that happened on a holiday weekend. I think it was Easter weekend. And we didn't want kids going to visit grandparents. And we ended up doing a testing clinic for a positive pool on that Saturday. And, which was fine. Everything worked out great. But, it's better, we find, to do it during school and not inconvenience families. We don't want pool testing to become one of those things that families say, oh, then we had to drive back to school. Or so doing it on Mondays and Tuesdays is great. We have our results, Tuesdays and Wednesdays. We can do follow up to pools. We can do our contact tracing. Sort of a well-oiled machine now when we get a positive pool. Again, we haven't had many. I think we've had 6 so far, but we've had several, positives picked up from those positive individuals. So it's really great to get that email, contact trace, get those kids that are true close contacts out of school, set up a testing clinic with our Binex now for day 5, and all goes really well. Challenging at the high school level, trying to figure out, how to do that when kids are everywhere. We pretty much figured out that it had to be done during one period. We met with administrators and figured out there was one period mid-morning that was extended because it had a mask break attached, and we needed 6 nurses to get all of the kids during that one period. I should say it's not all nurses. 2 of the people that do it now are not nurses. But we initially started with 6 nurses. We had 3 buildings that have an extra, not extra, any nurse listening realizes that's really not extra, but we had a second nurse in 3 of our buildings, and they would all go to the high school. And we had 2 parents, one who was a nurse and then another parent volunteer, who we all trained on the carts. And again, very anxiety producing the first time we did it. I think I just threw lots and lots of staff, and we practiced. We had a professional development day the week before, and we brought our scanners and we put them together and went through everything. And, you know, having the consent form done in a Google form that our IT department could then make up, you know, who's where when, and hand us those rosters. We added what columns we wanted. And when kids come out, we have them do their swabbing. As they go to put their swab into the tube, we check their name off so that we know exactly, you know, if we missed somebody, you know, we know what's in that tube and how many, and then just move on to the next classroom. At the high school, there's 2 floors and 6 hallways. So having 6 carts fully stocked with swabs and tissues and trash bags and gloves and all has worked really seamlessly.
That's great. And I think, you know, the testing schedule and plan can vary widely by school. I know lots of schools, particularly in the high school and sort of later junior high, have very complicated schedules for students. We can help you think through that. We certainly have lots of experience thinking through that. I think the goal is to try to catch the same cohort of kids every week. We do test every week. And so sometimes we have to get a little creative, but it's definitely doable. As Kathleen mentioned as well, and I love your comments about extra nurses, because you are very lucky to have even people you would consider extra nurses. You do not actually need a nurse to supervise collection in this program. The program is designed to, of course, we love to have the nurses involved and certainly need your support as a pillar of the school. But you do not have to be there to supervise collection. These are non-diagnostic tests, and so they don't require medical supervision. But of course, it is always nice to have the nurses involved. We also, as Concentric, can help you supplement your staffing. So we have staffing services available. We can send someone out to your school, potentially use the same person for your district, who can go around to classrooms and collect the samples and scan them into the system if you need the extra resources. As many of you can imagine, the first testing day, lots of people are nervous, and the idea of you know, supervising the swabbing and being responsible for closing up the tube can be very intimidating to teachers. However, what we found is that once you see testing on the first day, everybody's much more willing to get involved because it really is easy. And also, as Kathleen sort of alluded to, it's kind of fun. The younger students in particular, talking about boogers in the classroom kind of never gets old. And so after that first day, we realized that it's easy, and also the students kind of like it. Teachers are typically more willing to support. So we can always dial up or down staffing based on your school needs. So what the big question is, okay, so I got my test results and I have a positive pool. What do I do now? And just to level set, we have found in, sorry, I'm having trouble moving on to my next slide. We have found in Massachusetts that roughly 1 out of 120 pools are positive. So just to level set, the instance of a positive pool is not that frequent. So you're not having to follow up on positive pools all the time. Each school will have its own testing protocol as a follow-up. And I'll ask Kathleen to share hers, but just as a sort of general overview, and the reason why we don't give specific follow-up guidance is because it changes. It changes by school. It changes by the way that your Department of Health is set up. It changes based on sometimes infection rates in the community. But essentially, there are a few different ways to respond to a positive pool. You can immediately isolate the students and staff members in that pool. You can send that pool to go get tested with a community testing option. That could be, a community testing site. It could also be an in-person site if you have something at school. It could be with an at-home kit. It could be any version of individual follow-up testing. And then many of our schools, because we've come this far during COVID, already have rapid antigen tests like a Binax Now available at school, or they have a program for students to go get tested when there's a suspected close contact or positive. But I will have Kathleen talk about how she handles this in her schools.
Yeah, so again, we've only had 6 positive pools and we've had about 12,000 tests. So I guess we've done well. Our community has low numbers anyway. But the first 2 positive pools, and again, the first time it's like, oh my gosh, you do want to isolate. And we did send them all off for PCRs and had them go outside. And we did find that 2 of the parents of the 8 in our first pool were not happy that they had to. We don't have a facility to do PCRs, in school or in our town. So we did have to send them off after that first experience because we didn't want people to say, oh, we don't want to do pool testing. It's too much trouble. So we started doing the Binax Now tests, and that has worked beautifully. We have found the positive person in the pool. Usually as soon as, we get that email, generally it's first thing in the morning, and we just call the staff members or the students down and check that pool right then and there. So we can immediately start contact tracing. So that's worked really well. I was a little nervous with the Binax Now, thinking, would they really pick up the positives if kids weren't symptomatic? But we have often found that indeed kids were symptomatic. That tested positive in the pool, just really hadn't told anybody, oh, it was just a cold. I didn't, or even parents didn't know that kids had some more minor symptom, COVID symptoms. But the Binax Now testing has been really great. It's a nice partner to have with the 2, and great that we can do it during school, and parents are thrilled about that. And then we'll use those, the Binax Now tests, for our follow-up for close contacts. So that's great. We just schedule those clinics during the day and just pull kids out when it's convenient for their schedule.
That's great. And we have a lot of schools using rapid antigen tests to use as their follow-up testing, and it seems to be working really well. We also have some schools who immediately quarantine the pool. So it really just depends on your school policies, and we're happy to talk that through with you and talk through the pluses and minuses of different options. But we are purposely flexible in terms of the follow-on testing, because we know that schools and departments of health have different situations. And so it's not a one size fits all program. So that's kind of the general overview. And as I mentioned, the reason why we developed this program is so that schools can offer weekly testing to asymptomatic students and staff members. And in doing that, the tests are incredibly affordable. They're as low as $6 per student. It's simple. The self-swab process in the classroom is pretty straightforward. You heard Kathleen say, we say less than 15 minutes. It's really probably, in Kathleen's experience, it's more like 5. So it really doesn't take up a lot of classroom time, and that's once a week. The biggest benefit is that it offers peace of mind. I was in early education before I came to Concentric, and I know that those measures that you take in school to make everybody feel safe, that are sort of a constant presence, that are visible, that are proactive, those are the things that really help people get comfortable being there in person. And it's empowering. This is a way that parents and kids feel like they can make a difference during this time. And I'd love to hear from Kathleen. What are your thoughts on the need for testing with the increase in vaccination rates? Because we get this question a lot.
Yes, I think before, that was why we started the program, because we weren't vaccinated. But, we are still seeing some positive cases of COVID with people who are vaccinated. And again, not everybody is, and certainly not all our kids are at this point. I know we're now going down to age 12. Some of our 16 to 18-year-olds are already vaccinated. But I think until everybody is vaccinated and this virus is under control, I think the testing is still going to be really critical to do. And I think it's going to be great going back to school. Parents will feel that sense of comfort. Coming back after vacation, many of our families traveled over spring break. We actually did pool testing twice that week. And we did it Monday, we came back, which was great, but we actually caught a couple cases testing that Wednesday. People had come back and it had been given a few days there for the infection to show up in kids. So I'm glad we don't do it twice a week, every week, because it does involve, a bit of work on the part of the nurses and their teams. But it really is, I think, very empowering for families and for staff. I think there can be a lot of union issues along the way here with teachers feeling uncomfortable being, back in school, kids 3 feet apart. And I think testing was one way to sort of allay everybody's fears, that we do have a good sense of what's going on in our building, and we're reacting really quickly before, knock on wood, we have not had any in-school spread. Any of our bigger cases have all been, a party, a sports team, not necessarily the team, but the sports team's group of kids that, have been together socially. So it's been really great that we pick it up at school, even though most of the spread is happening in the community.
That's great. And I love the idea that when you feel like you need it, you can add that extra layer of testing in a week. We did hear a lot of schools do that after spring break, and I suspect some schools will do that, when we restart for summer school and restart in the fall as well. I think that's a great plan. Kathleen, I'd also love to know, what impact has pooled testing had on your school community? What are you hearing from parents in the community?
Yes, I think our families are so happy to be getting back not only their kids to school full time, but also all the activities that, our high school kids really want to be on their sports teams and play their games, or, be in their plays. And so I think that's really helping. Kids really want to know that, everybody else is negative too, and that they can go forward and participate in the things that they love. Not necessarily school, but we hope so. And definitely their after school and community activities.
Yeah, and we're hearing from a lot of sports teams these days that as the weather gets warmer, particularly in our southern states, it's harder and harder for kids to wear masks on their sports teams. And so this has become a great way to screen the sports teams on a more regular basis. So that's been great too. So, we've talked about how this program sort of extends beyond the school. But what we're really seeing the impact, you heard Kathleen talk about stopping the spread of 8 potential positive cases. That has an impact, a ripple effect into the community as well, because as you contact trace for those students, you've probably caught even family members spreading COVID before that becomes an issue. So one piece of the program that you've heard Kathleen talk about and is always a hot topic with our new schools is how to get parents and students bought into the program. We have a consent form that we provide to all of our schools. We have a paper version and an electronic version, and then some of our schools like Medfield, where Kathleen is, take it one step further and create their own Google Doc. But the idea is that we have to get consent from families for their students to get tested. And we never expect 100% consent rate. Getting parents to consent to testing. I will say, having come from early education, I realize that probably half the battle is communication and getting parents to do anything. I am guilty of that as well. It's hard enough to get a permission slip back. And then part of it, of course, is education about what we're doing and why we're doing it. And so we have lots of tools to help with this process. Our consent forms come in multiple languages. We offer parent info sessions. We will happily do a Q&A with parents. And a big piece of this is communication about testing to begin with, how pooled testing works, what exactly we'll be doing with students on testing day, but then also what happens when there's a positive and how do they play a role in that. So really just making sure that we have as many parents bought in as possible. And I have to hand it to Kathleen and her district. They did a beautiful job of this. And I'd love to hear from her, what are your best practices in terms of obtaining consent? And what are the challenges communicating with both students and parents? And how do you manage those?
Well, we pretty much talked about pool testing at every single opportunity we had. I'm on the Board of Health, so I talked about it there. And we always have a big audience on our Board of Health calls these days, very different than other years. And we talked about it at every PTO meeting. It was in every principal's blog. It was on the nurse's Twitter account. Each classroom also has each class, like the class of 2021, has a Facebook page that a lot of parents utilize, and we put the link on there. I think we got a lot of responses from the Facebook page and our Twitter accounts. But, again, every blog, every newsletter, it's on the website. The principals talked about it. We talked about it at staff meetings, everything that we sent out. Parents tend to look for our weekly nursing updates, COVID corner chats kind of thing. And we had it on there. And I think just, we had a lot to start, sort of was 60%, 70%, 80%. We're in the low 80s at our middle and high school. And have just been doing it for 3 weeks now at the elementary level here. And we had, I think, 65% the first week. And parents saying, oh my goodness, I missed it. My kid was really mad at me that he didn't get to do it. I was like, wow, I wasn't expecting that. So we really have a lot of buy-in here, but we did, I think the timing was right because we were, parents were fighting to get their kids back to school. So again, this was just another tool in the toolbox to make that happen.
Yes, and one of the things I love that you did is the nursing staff, I think on the first day of testing, made it a pool party theme and wore pool floaties, which was awesome. They were actually featured on the news. How did you come up with that idea?
Oh, that was, believe it or not the elementary nurses. That was our high school nurses that started with that. And the kids just loved it. So yes, it what did make for a good photo op too.
Yeah. So I think that, the key is that it's a repetitive message. And by the way, 80% consent in a classroom is awesome. As we're talking about the kids, we hear all kinds of funny responses about the things that we say to kids and the things that kids say to us on test day. You've heard us talk about boogers down. We have an awesome video of a second grader, showing us how to self-swab and put his swab in the tube, boogers down. And some schools have a jingle, 1, 2, 3, 4, switch it over, do 4 more. It really is, students get pretty into testing on test day. Kathleen, you've spoken a little bit about this, but how do you get students feel comfortable with testing?
It really hasn't been an issue. We do at the elementary level in particular, would do a demonstration for them first. And I think because they all do it together, is the other thing, space 6 feet apart. I don't think, there really hasn't been any issues with getting buy-in from kids. They're happy to do it. They do it quickly. They know what it is. And again, the kids at the upper levels, understand that it enables them to be in school and to participate in their activities. At the middle school level, I should have mentioned, the testing is done. We only need 3 people. It's 2 nurses and then a parent volunteer. And they have an extended mass break to make the lunch period a little longer. And so the kids test before or after lunch, behind a screen. Sometimes it's outside. We eat a lunch outside a lot these days. So they do have a screen up, so kids have a degree of privacy, not that nobody seems to mind doing a swab in front of their friends, but buy-in has not been an issue, and we've not had any trouble with kids not wanting to participate.
That's great. That's great. So now that we kind of have talked about what testing day is like, sort of how it works within the school, we'll talk about kind of what Concentric can do and what we expect of the schools. So we at Concentric, once you sign on to our program, we put you through a brief training session. As you can tell, it's not a very complicated program. So training is it's pretty short. We give you all the information you need, instructions on everything from how to order your supplies to who to go to for support. When we send out our test kits, they include everything that you need to run the test. So shipping labels, the tubes, the swabs, all of the bags, and the test includes shipping to our labs, and then also our lab services. So we work with partner labs all over the country to get you a lab that's as close to your district as possible to shorten turnaround times. And those labs all report back through our testing portal. A note about our testing portal: we actually don't have any PII or HIPAA issues with our testing data, because as you'll remember, all of the student swabs go into a pool, and we test 5 to 25 students at once. So there's no personal information communicated through our testing portal. On the school side, you may provide PPE, particularly for that person who is in charge of closing up the tubes. Certainly, if somebody is helping students swab, we recommend PPE, but it can be fairly limited. Supervision, just it's typically one person who can walk around from classroom to classroom, pick up those tubes. I know Kathleen schools use a cart with a laptop on it. They will pick up the tubes, immediately scan that tube into our system, and put it in a FedEx box to take it to drop off. We do expect schools to handle the communication with students and families. We will provide you with all of the resources that you need. We have templates for every medium you can imagine. And if we don't have it, we will create it for you. But we found that it is best practice for schools to own communication with students and parents, because that is what you do. That's your world. And certainly the sharing and tracking of those consent forms, we can provide lots of support in that area, but schools are ultimately responsible for that. And as I mentioned, we're building a nationwide lab network. And so our goal is to reduce those turnaround times as much as possible. And so we try to send your samples to a lab that's as close to you as possible. At this point, we have partnerships with 54 labs nationwide. We also have a partnership with Quest Diagnostics, who many of you have probably heard of through other testing experiences. And so our lab footprint is pretty extensive at this point. So what can you do if you are interested? One, feel free to contact us at k12@ginkgobioworks.com or text SWAB, SWAB, to 52886 to ask your governor for testing if you are looking for that state funding. The next piece is just to make a plan. One thing that I highly recommend, having come from early education, is if you are considering this program, particularly if you're trying to encourage students and families to come back to school in the fall, we highly recommend that you pilot testing during summer school, at least in the schools where you're holding summer school. One, it will give you good ammo to go back to those families who are not sure if they want to come back, and let them know that we have this great new program and we're already piloting it. And two, back to school is typically a very hectic time of year in my experience. And so adding something like pooled testing to day one of back to school is just an extra challenge that none of you need. So and as you know, Kathleen pointed out, and as we've discussed, that first day of testing is really key. That's when everybody kind of works through any nervousness and realizes that it's really a fairly easy, straightforward program. And so to the extent that you can get that out sooner, it'll be one less thing to worry about when you go back to school in the fall. We're happy to talk through how to make that happen. Spreading the word, sharing those consent forms, sharing education opportunities with parents. We have lots of great content on the website for parents and students. We have a whole comic strip designed for students to educate them about the program. And get your students ready. We have a TikTok swab session for them to check out for the cool kids in the house. So I will get ready to wrap this up, but before I do, just wondering if anyone has questions. I haven't seen anything come through over the chat, but feel free to chat in now if we didn't cover something. And I also just wanted to thank Kathleen for sharing her experience today. It's one thing to hear it from Concentric, but it's far more impactful to hear it from a lead nurse who's going through it in her own district.
Oh, very welcome. Sorry about the tech issues. We had MCAS today. I think our technology is done.
No worries. That's an excellent excuse. It's we've all had our Zoom issues, so no worries. But thank you for joining us. This was incredibly helpful.
Super, and happy to help anybody start. We did go out to a couple towns and help them start, so it's been great. Thank you.
Thank you. So feel free to reach out anytime. You can reach us at k12@ginkgobioworks.com. We're happy to put you in touch with schools who've done this before, including Kathleen. Let us know if you have any questions or if you're interested. Thanks for joining us.